Hello, ladies, and all my viewers. Welcome to We Do Women Empowerment Define the Odds. Today, I have a special guest. This is Dr. Molara Alexis, infectious disease specialist, and she practices at Southern California Hospital. Today, I have Dr. Alexis. She's going to talk to us about the vaccine because a few of my viewers have reached out, had questions and concerns about the vaccine. So hopefully, Dr. Alexis could debunk some of the myths and help us some of the things that we're that's bothering us and those sort of stuff. Here in Canada, May 4th to the 10th is Mental Health Awareness Week. So I think this would time perfectly because I know for me too, it's a little mentally disturbing and distracting sometimes. I'm in the hot spot in our area. It's time for my age group to get the shots, and there's lots of questions surrounding it. It's just quite disturbing, the things you're hearing out there. So, Dr. Alexis, help us debunk some of those myths.
Well, thank you. Thank you for having me on your program. I'm honored. As Irva said, I am an infectious disease specialist. So I went to medical school at St. George's University, and then I did a residency in internal medicine in Brooklyn, New York, and then I did a fellowship in infectious diseases in Detroit, Michigan. So I'm working at two of the local hospitals in Southern California. So I've had a good bit of experience with COVID, and I just want to share because I know there are a lot of questions out there. So first of all, we want to talk about some of the myths of COVID that are definitely not true. Mm-hmm. One thing that we hear a lot is that this COVID vaccine has something to do with the mark of the beast. And we understand and we know based on the Bible, I'm a Christian, first of all, a Christian physician, and maybe we should just pause and pray, dear God, just help us in this talk here today. Thank you. Amen. So Amen. First of all, we understand based on the scripture that the COVID vaccine is not the mark of the beast. The mark of the beast, we're not talking primarily about that now, has to deal with worship. You cannot get the mark of the beast by getting the vaccine and, you get the vaccine and then like 2 weeks down the road or 3 years down the road, someone says, oh, well, you got the mark of the beast because you got the vaccine. So the mark of the beast has to do with worship in the last days. The COVID vaccine has nothing to do with that. Some people talk about the COVID vaccine being used to track you and to know what you're doing and your habits. So that is not true. There's nothing in any of the COVID vaccines that track you. Now, the phone that many of us, maybe all of us use, this can be. So if people are really concerned about people not tracking them, maybe they shouldn't be using a cell phone. I'm just saying. But the COVID vaccine, it does not track. The phone tracks us more than anything else. The COVID vaccine has nothing in it that will track you and let people know, your heart rate. People say there's something in it. They can know your heart rate. They can know when you go to sleep and all sorts of things. These are not true. Another thing, some people say it changes your DNA. It will change your personality. So this is not correct. This is not correct. So there are different types of the vaccine. There's the Pfizer vaccine and the Moderna vaccine. And what these vaccines have is a piece of genetic material called mRNA that is introduced into the body. And when that is introduced into the body, the cell uses the instructions on this genetic material to make a protein that is similar to the SARS-CoV virus, the virus that causes COVID. So the instruction tells the body how to make a protein that is similar to this coronavirus. So when or if we come in contact with this virus, our body is already aware of how to prepare for it and to destroy it. So the genetic material that is used, as soon as it is used to make instructions for the protein, it is destroyed by the cell. It does not enter the nucleus of the cell, so the body doesn't use it to integrate it into the person's DNA. The vaccines do not change your DNA. As soon as we get the vaccine, it comes into my cell. My body uses the instructions. It's like a book. It reads the instructions and it tells my body how to make that protein that is similar to the virus. And so when the virus comes, when I come into contact with the virus, my body says, oh, I know how to make the equipment ready to destroy you. So this genetic material does not enter the nucleus, which is the brain house of the cell. It's destroyed. It does not enter the DNA. It does not change the DNA. It doesn't make people infertile. Some people are fearing that if they take it, they cannot have children. That is another. And the final myth, I know time is good, I want to talk about is that the vaccine cannot give one COVID. Some people say, oh, when I take the vaccine, I'm going to test positive for COVID. You do not test positive for the virus that makes the COVID disease, excuse me, what you test positive for. So when you get the virus, your body makes proteins against the virus, excuse me. So you're not testing positive for the virus, you're testing positive for proteins that attack the virus. So I just wanted to clear up these myths. I knew I was speaking very fast because we have limited time, but these are some of the important myths that I want to clarify regarding the vaccine. And then we can take some questions that I think some people.
Well, you know what, before we take the questions, Dr. Alexis, you said a few things, because I know I hear a lot of people just walking around the streets talking a lot about the mRNA and how it's going to change your genetics when you take the shot. So I'm really glad though that you debunk that myth. It doesn't change your DNA. It makes the protein, if I understood you right, that when it comes in contact with the virus, the body already knows, and the body would react because the body has proteins that can kill those viruses, or I guess work against those viruses.
Yes. So the genetic material now tells the body how to make the similar protein that is on the surface of the cell. So when you come in contact with the virus, the body already knows, it's prepared for it because it has seen it before. And this genetic material that is introduced in the vaccination process does not remain in the body living. It is degraded, it is broken down, it does not enter the nucleus of the cell, it does not enter into my DNA and change who I am as a person. I do not turn into a lizard or any such thing.
Or grow an extra limb. And I think a lot of the concerns, though, people are wondering what's going to happen in a year. Am I going to grow an extra finger? Am I going to get cancer? Am I going to be infertile? I thought about that also. I mean, I'm not in the way of being fertile at this point or not, but these are questions as a woman that I ask myself if it's something that will cause you to be infertile. And I'm guessing that you can understand the viewers and the population's concern, because we've never had a vaccine that happened so fast. And also, there've been so much conspiracy theories out there about COVID to start. So I think that's maybe where a problem started a lot. People, at first, COVID didn't even exist. And to this day, COVID doesn't exist for some people. And now people are saying they're just promoting this vaccine to depopulate the world. I heard that one too, to make us sterile. There was a point where it was meant for Black people and all sort of stuff. So thank you for telling us it doesn't change your DNA or anything like that. And I love the mark of the beast also. That's a few things that's been going on there. And I probably wanted to ask, and I know our church had a stance on the COVID vaccine because people were concerned. And I love the fact that you mentioned the phone tracks you more than anything else in the world, probably. So we did have some questions that came in from viewers. One of those questions I'm gonna ask, simple, which is better, Pfizer, AstraZeneca? And I'll ask, or Moderna. I'll put in Moderna myself. Which is better if you had a choice?
Well, so here in the United States, the Moderna and Pfizer vaccine have been given approval for use, and also Janssen most recently. And in Canada, I believe AstraZeneca, in the United Kingdom, AstraZeneca, in the Caribbean, AstraZeneca. So all of these vaccines have been studied and have shown that they can be effective in preventing or reducing the chance of getting critical COVID or severe COVID. So I can have COVID with no symptoms. That's probably if somebody has to get COVID, they would want it with no symptoms. But at the other end of the spectrum, there is critical COVID, severe COVID, where you end up in the ICU. So these vaccines have been shown to reduce the chances of getting severe COVID, all of them. So in terms of saying, pick this one, pick that one, I think that the ones that are available to us, wherever we are, we should use them. I do want to mention that there are some instances where there's a contraindication to the vaccine, meaning that you should not get it. So you look at the, the CDC website or when you are getting the vaccine, there's a fact sheet that tells you the ingredients. Mm-hmm. If you are known to be allergic, a severe allergic reaction or immediate reaction to any of the components of the vaccine, you should not get it. All right. Mm-hmm. So if you know that you're allergic to anything in the vaccine, if that you know that, or if you've had in the past immediate reaction, like 4 hours after you get the vaccine, there is some, shortness of breath, swelling of the lips, things like that, that's a contraindication. You should not get it. So that's one thing I want to say. Mm-hmm. Also of note, there was a pause in the Janssen vaccine, and the pause was because there were some incidences of blood clots with low platelet levels. So platelets are part of the blood that help people to clot, if you bleed, not to bleed to death. Mm-hmm. So I am not here to say one vaccine is better than the other in preventing COVID, but the updated information that we have on the Janssen vaccine is that it has been seen there are some instances, particularly in women under the age of 50 years old, we are seeing that there was a few of them. Let me quote the figures so that I don't just speak off the top of my head. I have written it down right here. So concerning the Janssen vaccine, there were 6 cases of these blood clots in 6.86 million. So when you look at 6 to 6.8 million, it's not a lot, but we still see it. So there is a warning on the Janssen vaccine, and that there is a rare possibility of getting this blood clot. Also with the AstraZeneca vaccine, yes. The authorities in the United Kingdom, they have said that the benefits of the vaccine outweigh the risk, but they have noted that for women between 18 to 29, if there's a low risk of infection, probably they should be offered another vaccine. So if I were to summarize all that I said, all of the vaccines that have been authorized, when I say all, let me be a little more specific. The AstraZeneca in the United Kingdom, and because I don't practice there, I also speak about the Pfizer vaccine and the Moderna vaccine and the Janssen vaccine. These have been shown to reduce severe and critical COVID, but we must be aware that if we are allergic to any of the components of the vaccine, that we should not take it. So there's also new information with the Janssen vaccine that there is a small possibility of these blood clots. So this is something that we need to consider. Small possibility, six cases out of 6.86 million of clots in the sinuses in the brain. They call it CVST. AstraZeneca, again, there is the benefits are greater than the risk, but we must be aware that there's this small possibility with the AstraZeneca and the Janssen vaccine.
So can I, because I know here in Canada, so we have AstraZeneca, Pfizer, and Moderna, sorry. And I know AstraZeneca, there have been a few cases, I think 1 or 2, where women got blood clots and died. So what you're saying, though, if you know if you're prone to blood clots or have any issues of read the fact sheets, see the contraindications, and know that's not one you should take. Is that correct?
Yes. So to be clear, again, you look at the fact sheet, you look at the ingredients of the vaccines, and you make sure that you are not you have no allergies. Well, everyone probably knows what allergies they have. Sometimes we find out after the fact, but you look at it, and if we know we're allergic to something, we look at the fact sheet and we say, okay, it's this, that. I'm not allergic to that. Therefore, I can go ahead and take it. Again, I'm saying with the Janssen and AstraZeneca vaccine, there have been a causal relationship, meaning that there have been some incidences of these blood clots with Janssen and AstraZeneca. So it's a discussion that people should have with their healthcare provider. I'm not saying I not take the Janssen vaccine and AstraZeneca. I am not saying that. I'm just saying that there has been noted a few people having blood clots. Again, it's out of millions of doses. It's less than 10. With the Johnson vaccine, we have 6 of those particular clots. AstraZeneca, I believe they had 168, looking at clots in general out of 21.2 million doses. So when you look at the incidence, it's not a whole lot. And we have to take things into perspective, because there are other things that can give us blood clots, or all medicines. Many things have side effects, but you have to weigh the benefits against the risks. So probably if you have a particular concern, it'll be useful to speak with your own healthcare professional to kind of look to see your particular risk and benefit and decide, do you need to take this particular one or that one? But again, these vaccines are good in reducing, they're effective rather than reducing severe critical COVID.
Perfect. Thank you. Thank you. And guys, I want to put it out there. She's saying you should, if you have concerns, talk to your primary healthcare practitioner or provider for very specific questions about your concerns or your health.
Yes.
Another question is, why do we still have to wear masks after the vaccine? How long do we have to wear the mask? And if the vaccine doesn't stop someone from getting COVID, I guess this person is trying to say, why do we need to take it? So if the vaccine doesn't stop someone from getting COVID, why do we need to take it? And if we still have to wear a mask, why do we still have to wear a mask after we take it? And I think, how long do we have to wear a mask for after we take it?
Yeah, very good question. So the vaccines are, the main goal of the vaccine is to prevent severe or critical COVID, meaning COVID to the extent that you're hospitalized, needing oxygen, ending up in the ICU. So it is known that, or rather I should say, it is possible to get the vaccine and still get COVID. But the hope is that we would not get that critical COVID where we end up in the hospital. So I may get the vaccine and I may still get the COVID. But the fact that I got the vaccine may, and that's what the studies are showing. The studies are showing that they are preventing us from getting critical COVID or COVID that sends me to the ICU. So I still wear the mask as a form of protection, because there is a possibility that even after I get that COVID vaccine, that I may still, we don't know, that this is another question people ask, like, if I come into contact with this virus, can I transmit it? We're not sure about all of that information. So what we know is that this vaccine is very effective in preventing severe and critical COVID, but there's always a possibility of someone contracting COVID after the vaccine. And for this reason, we still say that people should wear masks. But again, the hope is that we reduce the incidence of severe and critical symptoms of COVID as a result of the vaccine. That's why we wear the mask. And for how long? We wear it until we have enough herd immunity. Herd immunity means that sufficient people in the population have developed immunity to this. And we are hoping that soon, but unfortunately, I can't say when that is. So again, we still wear the mask, because although the vaccines reduce the incidence, although they have been proven to reduce the incidence of severe COVID, there's still possibility of getting COVID, but maybe not as severe or maybe without symptoms.
Okay, I'm gonna, and I don't know if that's something you probably can answer right now, but as you mentioned that, something popped into my mind, because where I live, for example, we have the double mutant strain from India. So for people, let's say I'm taking the vaccine to prevent the first strain we had. Now we have the other strain. So what happened that those cases? Can someone still get, after the vaccine, still have critical COVID from one of the other strains? So the vaccine is only specific to a specific strain.
Okay, so that's a good question. So there are many strains. We have the strain coming out of the United Kingdom, one out of Brazil, and then there are 2 here in California that we have, and South Africa. So the question is, if I take the vaccine, if I'm hearing you correctly, will it protect me from these different strains and variants? So the variants, and this is an ongoing thing that the authorities are working on. The variants may affect the ability of the vaccine to protect, but it would not reduce it altogether. Let me probably clarify that and say it a little better here. Some of the upcoming studies, for example, there was one study that was done in Israel where they have a lot of or they have a good bit of the UK variants, and they found that even with the original vaccine, that there was still some sort of protection. So maybe the variants may cause the vaccine not to be as effective as it would have been in the absence of the variants, but there would still be some protection. Okay. So the idea that we should not take the vaccine because there are variants is probably not a good idea, because the vaccine still does offer a good amount of protection. Maybe in the next few months, we may hear about booster shots, because, for example, the flu vaccine, you get one every year because this is the way viruses operate, they change. So the vaccine I got for the flu this year, I have to get a different one next year. It may end up being the same thing for this COVID vaccine, that we may have to tweak it a little bit because of the variation. But we need to still go ahead and take it, even though there are variants, because it would still offer some protection. Maybe not as much as we would have liked in the absence of the variants, but we believe some protection still.
Thank you very much. Another question from one of our viewers is, what is the incidence of healthy children, the number of underlying comorbidities or obesity, contracting severe COVID, resulting in ICU hospitalization or death? So I'm guessing your studies, that would be for the US, not for Canada, but still it probably gave us an idea. I don't know if that's something you can answer.
So the question is a very thoughtful question, because I think many of us know that there are certain risk factors such as obesity, diabetes, hypertension, chronic lung disease, older in age. These increase your incidence of severe COVID. However, there appears as if there may be some kind of genetic component. I don't think that we know exactly what it is, because you would find people who may not have, they're not obese, they don't have diabetes, they don't have hypertension, and they get severe COVID. You know, unfortunately, I don't have the figures before me to say, you know, how many patients without any risk factors ended up with severe COVID. But from my own little mind experience, you know, you can see there's some patients who you may have thought would have done well because they didn't appear to have all of these risk factors, but they didn't. So in essence, there may be a genetic component contributing to people who appear to be healthy and who are healthy, who may end up with critical COVID. Again, in children, there's this syndrome called multi-system inflammatory syndrome in children. Most of the children who get it are healthy, but after COVID, they end up with this kind of inflammatory syndrome, which could be very critical. So in essence, even though someone is healthy, there's still a possibility of getting severe critical COVID. There may be a genetic component to it that we don't fully understand, but healthy people do get critical and severe COVID. And even in children who are not as severely affected, we do have children not doing well. We have heard reports of children dying. And even after the COVID, there's this syndrome called a multi-system inflammatory syndrome after they have recovered from COVID, where their organs can just shut down on them. So unfortunately, although being healthy should reduce your chances, sometimes you still end up having a critical case. So this promotes us to say that one should not say, well, I'm healthy, I'll never get critical COVID, so I don't need to take the vaccine.
So, and I'm going to ask this question here because you talked about that. For me, though, it seems like there's so much uncertainties in what's causing it, what would happen after you got it. And I think that's where the uncertainty is in taking the vaccine. Do you think, so I'm asking you your opinion now, do you think there's enough information, even if there's a lot of uncertainty about COVID, do you think there's enough information or studies about COVID that we'll come to the conclusion that it's okay to take the vaccine? Because we know enough. The little that we don't know wouldn't affect the outcome or sort of weigh the pros and the cons. I'm not sure if I'm making sense here.
Yeah, I hear you. And some people that I've heard from, they're concerned about the speed at which the vaccines come out, and then they're, you know, most of us, when we were born, the vaccines were there. We met them and we knew about them. But now we have, we came and we had the polio vaccine, MMR, Tdap, they were there. So we didn't have to kind of wonder about these things. And this is a question that people are asking, well, is there enough information now? So the speed at which these vaccines are created. Now, this is a pandemic. In the past, when we were developing other vaccines, I don't think all the nations were pulling so much resources into it because it wasn't a pandemic. But now that every nation is affected, everyone is pulling the resources. So the speed at which we're developing the vaccines, it shouldn't surprise us. Oh, is that the best way to say it? Oh, let me say it this way. The speed at which we are developing the vaccines is, I believe it's driven from the fact that we're in a pandemic. All nations are affected, so everyone wants to find out how to address this COVID pandemic. Now, again, the technology behind these mRNA vaccines, it's the first time we have the mRNA vaccines, but however, they have been studied before, so it's not like something that we just thought up in 2020 or 2019.
Okay.
It was something that was in the pipelines, but now that we have this COVID pandemic, is the time where we think, well, this thing that we've been studying, let's put our resources into it to see how we can get it to work for us. So that's the one thing I want to say. Because it's a pandemic, we have all these nations, all these scientists pooling their resources and financial resources into attacking this COVID-19. So that's one thing. The second thing is there enough information? So the vaccines that were approved have, been in phase 3 trials where you have people being studied. So the phase 1 and phase 2 trials, they have few participants. But for example, when you look at the Pfizer vaccine, they had about 21,000, a little over 21,000. The Moderna was about 15,000, J&J 19,000. So you have thousands of people in these trials, and they are in different countries, in the United States, Argentina, Brazil, South Africa. So it's a multinational study, meaning different nations and thousands of people.
Yes.
So because of the number of people involved, the different ethnicities and the different places, we're getting a lot of information. And many of the side effects of the vaccines are normally discovered within the first year or so. Now, this is not to say, obviously everyone knows I'm not God, so I cannot predict the future. This is not to say that maybe a year, 2 years down the road, somebody may discover something new about the vaccine. But generally, the side effects that we get from vaccines are normally obtained. The information is normally obtained within the first year or so. So we tend to know the general side effects within the first year. For example, we have come to find out about the blood clots, and that's within the first year. It's not 5 or 10 years down the line. So generally, because you have so many people involved, thousands of people involved, you're able to get a lot of information quickly. Again, would there be other long-term effects 10 years down the road, other things we may find out about the vaccine down the road? Maybe. But again, generally, you tend to get all the information, earlier on in the first year or so.
Perfect. So we're going to wrap up. We have 6 minutes, so you can answer 2 more questions. I don't know if you can answer them in 6 minutes, and then we'll wrap up. One of the questions was, why can't COVID patients, so people who have COVID, get the vaccine? And when someone tested positive with COVID, why the quarantine is only 14 days?
Okay, so if I have COVID, the recommendation, so when I have COVID, it is believed that I would have some natural immunity for at least 90 days. So if I have COVID, from 90 days from my COVID, I should have immunity. So some people could wait 90 days because they have their own natural immunity, but that immunity, we don't know how long it lasts. And so that's why the vaccine is given, so that when our natural immunity may not hold up, we have the vaccine there that could provide us additional immunity. So again, if you have active COVID, you don't take the vaccine. But as long as you have recovered and that you're out of quarantine, you can take the vaccine. Some people wait 90 days because they would have enough immunity at least for 90 days. After that, you need some help in generating. Now, I want to just say that we may find down the road that we may find out that the immunity may be greater than 90 days, but for now, we think it's 90 days. So that's why it's still recommended, even if you had it, the COVID, to take the vaccine. And again, finally, why is the quarantine period 14 days? So the scientists, based on the studies, we have come to understand that after 14 days, generally, even though you may continue to test positive for the virus is replication incompetent, meaning it is not able to cause active disease. So
okay.
if I have COVID now and on day 15 or day 16, I may still test positive for the virus. But once my symptoms have resolved, I am no longer infectious. So I have patients all the time. They may come in a month after. They come in for something different, maybe a broken foot or whatever, and they test positive for COVID. They don't necessarily have it if their symptoms have resolved. Also, I want to say that if you have critical COVID or if you're immunocompromised, sometimes you may be infectious for more than 14 days. But generally, if your immune system is intact, you didn't have critical COVID, about 14 days quarantine is sufficient, definitely sufficient. One caveat, there are some reports of reinfections, particularly with the variant. So if somebody gets a second COVID test, that is when the physician needs to kind of think through everything and decide, is this test positive because the patient has recovered but just continues to have a positive test representing virus that cannot cause disease, or is it a reinfection? Because although they are not, overwhelming, there are cases of reinfections, particularly with the variants.
Perfect. So we have 3 minutes. Thank you for really wrapping it up there really quickly. Before I put out the spill in a minute, if you can, I don't know if you want to say if you took the shot or not, and what, if you had to give some advice in 1 minute, what would you tell us?
So I took the Pfizer shot. I'm an infectious disease physician, and I took it in the height of the pandemic. I'm seeing so many COVID patients every day. I pray to God to protect me. I wear a mask and everything that I need to do. But, I believe God gives wisdom to the scientists, and based on the information I saw on the fact sheet and I read the trials and things, I was pretty confident that, in addition to asking God to protect me, whatever he has allowed human beings to come up with, that is safe, that I should do. So I took it. Fortunately, I did not have any side effects, but there were colleagues of mine who had, some people had fever, headache, some people say, oh, I felt so bad, I thought I had COVID. But you do get side effects. Some people do get like pain, and the only one I got was a little discomfort at the side, which didn't last long. So some people get headache, fever, joint pain, vomiting, but we know when we have children and we give them a vaccine, they get fussy, they get side effects. So this is not uncommon. Perfect. So some people may get these things. But again, I want to say, if you take the vaccine and something does not feel right, please let your healthcare provider know. And that's how we come to understand that there may be another side effect that was not thought of. So if you have, for example, a persistent headache, abdominal pain, it's better to call your healthcare provider and they say, that's just a side effect of the vaccine, don't worry. Because again, with the clot, sometimes you get leg pain, some people get headache, different things. So if you have a symptom that's persistent, that's particularly if the side effects of the vaccine tends to be within the first 1 to 2 days. But if like a week down the road, you're getting new symptoms, please contact your healthcare provider and let's make sure nothing terrible is happening. And we thank God for bringing us through this pandemic. He will continue to be with us. And we thank him for what we were able to get from these COVID vaccines.
So I want to say thank you very much, Dr. Alexis. And guys, as she said, if you have any issues, speak to your primary healthcare practitioner. Thank you for sharing information with us. Remember to like, remember to subscribe, remember to pass it to a friend, and reach out to me if you have any questions. Thank you.
I just want to say, yes, please contact your healthcare provider. This is not, I'm not providing general medical advice here. Let me just say that. Please contact your healthcare provider. And if there was something I said you didn't quite understand, please send us a message and we can answer you individually. But again, please always speak with your healthcare provider. Perfect. Thank you for having me over.
Thank you. And my email is wedo7806@gmail.com if you have any questions, and I would pass it on to Dr. Alexis. Thank you so much for your time. Thank you for sharing with us. I appreciate it. Thanks for debunking all those things. I feel better, honestly, and I trust this lady with everything. She's a good, God-fearing woman, so I trust the opinions of her and the information that she provided. Thank you, Molara. Thank you,
God bless. See you later. Take care, everyone. Let us know if you have questions. Bye.
Yes, thanks.